Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
Welcome to Think Big with Dan and Qasim. And if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Yep, Richard Braman. I am a healthcare interoperability specialist, and I live in the Outer Banks of North Carolina.
Awesome. So can you just explain what that actually means? I think that many people don't really understand what that means, what exactly you do.
So I try to make healthcare records easy to exchange between patients, healthcare providers, the government, public health, and so forth and so on in a standard format.
Makes sense. So I guess in terms of a typical client or a customer, who would that be? Would it be the government, healthcare companies? Who's actually paying you for your services?
So it's either health insurance payers or large health hospital systems, or the government is primarily what the work that I do.
Makes sense. So as of right now, how big is your team?
We've got about 15 engineers that help us, with our projects, and we do a lot of product development. So some of those are just committed to working on the products that we have at Fly Health.
Makes sense. So is it a pure SaaS? What does the pricing model look like?
For us, it's a lot of services and support around the software. So the software is open source. So we don't charge licensing fees. We don't have a kind of cloud agnostic in terms of where you deploy our software, but we do, offer services and support kind of like a Red Hat model or Ubuntu, something like that.
Makes sense. Let's kind of dial it back. I'm curious, how did you get the idea for this business?
Well, I've been doing interoperability in the web for, I guess, 25 years. So it more or less went from other areas of interoperability that were more general into specifically working on healthcare. So I've been in healthcare for about 15 years now.
Makes sense. But I guess what made you want to pivot into healthcare?
Well, there was two reasons. One, when I got into it, the transformation to digital health records was just getting started. So it was a pretty blue sky, green field, market and industry to get into. And with healthcare, you have to kind of have the goal to help other people. So, I mean, it's I want to see healthcare improve for myself and my friends and my family and really the world. So you do have to have that mindset when you get, when you do something like healthcare, because it's probably not as lucrative as other high tech areas. It is and it's not. It doesn't have all of the, the flash and the stardom that, a typical Silicon Valley startup would have. So, it's really, you have to want to do healthcare. The good news is it's very consistent. So it doesn't have a lot of the crazy swings that other industries have through, recessions and boom and bust cycles. So
for sure. Yeah. I know that, oftentimes in the industry, it's the sales cycle can be longer, but there's not as much churn because, to your point, once somebody's on board and using the software, they need it, and healthcare is doesn't really go away.
No, it doesn't go away.
So I guess as of today, right? What does it look like for you in terms of customer acquisition? How have you guys grown this business?
Well, most of it has been, through word of mouth, I would say, and through various industry, participation in industry, some social media, probably LinkedIn being the one that's probably most impactful. Yeah, I mean, basically those ways.
For sure. So essentially you've gone to certain events and then you and your team have done lots of cold outbound, on LinkedIn, reaching people in the healthcare space about the software.
Yeah, basically. And I think, for the good news for us is we've had a lot of pretty high profile successful projects. So those kind of advertise on their own.
For sure. So I'm curious, like in terms of like some of your, I guess, success stories with your projects, if you can kind of, give us like an example, and just like how you've been able to help somebody specifically.
Sure. So last year was actually a really kind of milestone year, because we worked on a project for Intermountain Healthcare, which is the fourth largest healthcare institution in the United States, and it's probably the most technically advanced. And we worked on a really exciting project there, for pneumonia. So it's a decision support expert-based system, that could predict, as you go through the hospital and you're being seen for, pneumonia-like conditions, your probability of actually contracting pneumonia and making sure that they don't mistakenly send patients home, which causes problems for the patient, and for the hospital financially if they come back with pneumonia, let's say a few days later, when they could have been treated very easily before being sent home, if that makes sense. So, that project was featured at the HIMSS conference last year. So that one was very high profile and very rewarding because of the number of lives that it, could potentially impact if this method is, adopted across the United States, because pneumonia is causes a lot of deaths. I think around 100,000 a year,
For sure.
nationally.
Yeah, for sure. I mean, that's amazing. So essentially, like you help the Intermountain's healthcare system, and then from there, you presented like at a conference, and then more, and that's essentially kind of like what you were saying earlier, right? Like this channel of word of mouth, because they see the results you've been able to provide for people in the industry, and then from there, more and more healthcare systems are adopting your solution.
That's correct. And I think, it takes time, to build. I mean, I've been at this in healthcare for 15 years. So I do remember when we didn't have, any projects to reference, and it's definitely much tougher, than when you have good projects, that have good visibility into the market.
For sure. So essentially, like it was kind of this trickle down effect where you have like one good project doing something different, and then, then you kind of go from there, and then you build something else, and you're able to build these solutions across the board for different systems, right?
Yeah. And I
So,
think, well, I just wanted to say that the second, because we actually do, work on a lot of innovation, and certainly the project at Intermountain was very innovative, but there's also even a much more forward-looking view of healthcare and how it can be, administrated in the future. And we did a lot of work around that this year at working at various conferences, for Web3. So working on decentralized healthcare identities, which I think is very exciting. And so we do also get a lot of industry, I would say press and notoriety from participating in those developments and trying to position the company as a thought leader, in healthcare moving forward. So that's been another good thing for the last year.
that's amazing. So in terms of your clients, are they just in the US, or have you worked with, systems around the globe?
All in the US.
All in the US. Is there a reason why that you don't want, like you haven't worked with anybody in different countries, or is that more of just who you've kind of like come across?
Well, probably mostly because I'm here, but there are also, very stringent regulations around healthcare data, and moving across boundaries, especially international boundaries, probably creates, a little bit of problem for, working with hospitals and things like that in other countries, because it's just the data is very sensitive.
Makes sense. So what would you say is like the biggest challenge that you face in your business today?
The biggest challenge I would say is probably being able to actually get the right clients. So, a lot of, business, a good client is worth, 30 bad clients. So a lot of, the trick to a lot of it is making sure that you go through the opportunities that you have and prioritize them and and refine them as much as possible so that you get to the right project. Because there's a lot of projects out there that aren't probably going to go anywhere and that you're not going to be very profitable as a result of. So I think the biggest challenge is actually, because there's plenty of work to be done. It's just actually figuring out which clients are the correct ones to engage with based on, and a lot of factors go into that. Most of all, probably in healthcare maturity level, because, a lot of these hospitals, they don't have huge IT staff. So, the Intermountains of the world are the exception, but for every Intermountain, there's, a lot of smaller, institutions that you'd like to help, but that just might not be there in terms of capacity. And so it becomes a challenge to, want to serve them, but to also keep in mind that they might not be able to achieve what they're, even what they're looking to do. So I would say that's pretty challenging.
Right. So you're saying it's like a lot of these institutions, or I guess, healthcare organizations will reach out to you, but you have to turn away the business because it doesn't make sense for you in terms of your capacity and being able to serve them in a way that you want to serve them. And you're not certain that they can really get the results for a good case study, et cetera, that's even worth your time.
Yeah, I mean, and the more I think that we get into, offering products, hopefully that will change, because I think for the smaller and medium tier, they're not really looking for a lot of product right now. They get most of their product from one vendor, in the space that I work in. So they're kind of wrapped up by that vendor in a lot of ways. And they don't really have software development capabilities. So it's hard to hand them code and say, here, customize this for your particular use case and go with it, because they don't even have the processes nor the people to even be able to tackle, probably fairly rudimentary stuff, much less with a lot of interoperability. It can be fairly complicated. And so, they're kind of stuck in a certain spot. And I think that spot will improve, both because the government is pushing all hospitals to share data. So that's a huge driving force, but also, the next generation of business opportunities is going to probably very much hinge on these organizations' ability to digitally adapt. So, they need it. It's just how do you give it to them? And that's, I think, the challenge for a lot of the smaller institutions in the market.
For sure. So essentially, like, you're looking to create some kind of lower cost SaaS solutions that sort of will accomplish what they're looking for. And then that way they can, work on it and still get good results with, no code or low code, and really achieve like kind of, maybe not to the same extent of what you've done with like other systems, but like, kind of similar results, correct?
Yep, that's right.
Awesome. So in terms of what you do, right? I know obviously now in 2024 that, like I said, you mentioned Web3, but also many companies are like heavily involved in AI. So is AI something that you guys use a lot in your business? And if not, like, where could maybe AI add value in 2024?
So the data that was driving the clinical decision support at Intermountain, that's an AI based system, right? It's a rules based system, but it's still, working like a human being does. It's just firing a lot of different rules concurrently. So it's just the same way that your, a neural network works in the basic sense. So we've already done work with AI, and that being said, we've done more with AI based stuff over the last year, actually, being able to ingest healthcare data into, a machine learning algorithm to make various predictions about, anything. We've used it to develop test data for systems, so that, a system could actually mimic, a hospital system, like in terms of generating data. just like a hospital would. So that's a generative AI use case. And I mean, test data for healthcare is a very large opportunity going forward. It's always an issue on every project that you work on all the time. So
sure.
we've done that, and then we've also done some work around generative AI with Chat GPT. And I actually personally won a hackathon about 3 months ago from the National Academy of Science, Engineering, and Medicine for a development I made using Chat GPT, but we actually put some wrappers around it so that it was private. It doesn't require any kind of user logons or anything like that to use. It filters out any, personally identifiable information, and it scopes the chat to medical topics. That's probably the most important feature. So that you can't just ask it, who is John Wayne? You have to ask it actual medical questions, and it won't drift off into questions that are, going to pose potential risks for the service and for the user. So it won an award, and we're hoping to actually get that, out to the CDC and various public health institutions rolling it out this year. So that's been super exciting too.
So is that something that's kind of like customer facing, or is it more so for internal use for these systems?
Well, I mean, I think the what we're hearing is that these public health institutions would actually like to deploy this solution into their network. The use case is for for their people in their counties or cities or wherever their jurisdiction is. They have these problems with sexually transmitted infections. So it was the whole goal of this is to actually, provide this app so that people have a private, secure way to talk, with a robot basically about their STIs for purposes of not for diagnosis, but for purposes of patient education, which is a big thing. And then it can potentially drive them, if they need a clinician's help into, the clinical setting, if that's where their problem needs to be addressed. But they can
Awesome.
information, which is important, right?
For sure.
Sometimes.
No, yeah, that's awesome.
So yeah, I mean, these are all things that you kind of put the stuff out there, with hopes that it'll be usable, and that it'll catch on.
Makes sense. So what would you say are like some of your top priorities for the business in the next few months?
Well, I don't necessarily know that I have any super high priorities. I probably need to get back on social media and start putting more content out. We've been kind of in a lull here for the last couple months over the holidays, and it's hard. That is hard for small business to keep up with. We have lots of things to say, but we don't have a lot of time always to push them out there.
Yeah, for sure. I think it's a big challenge, and I guess it's a challenge for us as well. Sometimes we post, sometimes we don't post. It can be very difficult to be consistent when, to your point, that there's so many, conflicting priorities, that are more important than posting content.
Yeah, it all goes together, and sometimes you have to. We probably do a little bit of binging. I think we're probably guilty of that, and then letting it just kind of proliferate out in the network. The good news about the internet and the web is that the content doesn't go away. So, just having, your stuff out there, I think is very important.
For sure. So what would you say is like the one biggest piece of advice that you wish you knew before you started this business?
Wow. I would say that I would have been shocked if I would have, could go back and I could tell my 2009 self, like where we would be in 15 years. I thought it would have moved a lot quicker. So I probably, if I would have known the time horizons on a lot of the stuff, I think I would have probably prioritized different developments at different times.
Yeah, that's a common thing that we hear. I feel like in entrepreneurship, it always takes longer and it costs more money than you actually think in the beginning.
Yeah, and in this case, I mean, it's a massive ship to move. So, but there's a lot of reasons why it's moved slow. The government has driven most of the innovation with the funding since the High Tech Act, which was in 2008. So, they've been pushing a lot of the innovation forward with tax dollars, right? And there's been, I would say, a pretty, and it's gone to Congress, so this isn't my opinion, but there's been a lot of efforts to thwart the free flow exchange of your health data, especially to you as the patient, which is very troubling, right? So I would say that we probably could have gone back and changed our approach in 2009 as an industry on a lot of things and been a lot further along now with, what we're able to do, because there are certainly right now some limiting factors that cause, these data exchanges to not scale as well as they should be. And if you think about how, other innovative organizations that have not been government funded and mandated and have kind of had the way to go on their own, they've, we have all these crazy services now that, quite frankly are marvels in engineering, and we have that, but in healthcare, we kind of don't have that because of the way that the industry's structured.
Makes sense. So if we're going to have this conversation again in 1 year from now, where do you see things going for your business?
Well, hopefully the AI and the Web3 are the two big drivers, and that we can, the Web2 stuff that's, has paved the way thus far will continue to, provide opportunities, and we'll just continue to get the work done and drive as much innovation as we can in the marketplace.
Awesome. So if somebody watching this wanted to reach out to you, do you mind sharing your website or social media? I guess best ways to get in contact with you.
Sure. You can visit our website. It's very easy. It's fly.health. So that's easy enough. And then my email address is richard.braman, my last name, Braman, at Firefly, FHIRFLY.io.
Awesome. Well, Richard, thank you so much for your time today.
Yeah, thank you so much. I appreciate it. This is my first podcast, so
awesome. It was great. Yeah, thank you.
Yeah, I'm happy to have participated. Thank
Awesome.
you.
Thanks. All right. Bye.
All right. Bye-bye.